So, all right, it's actually 2 p.m. I mean, sorry, 1 p.m. and I think we can start already. So, good afternoon, everyone. Good afternoon to the sisterhood. Good afternoon to all the cancer groups that are who are present, and we are very excited here in I Can Serve for our webinar. And this is actually the second. The first one is something kind of physical. Ngayon po, talagang webinar wherein we'll be listening to a very makayang doctor. So let's get the ball rolling. I would like to turn over muna the mic. Yan. To our founding president, Cara Alikpala, to welcome each and every one of us. Cara?
Thank you, Nicoy. Good afternoon to all our sisters joining us on FB Live and Zoom. On behalf of the I Can Serve Foundation, welcome and thank you for joining this online conversation. Thank you for the overwhelming response. Ang dami-dami po natin ngayon. Sana nga magkasama tayo physically, but it's not possible because our world has been turned upside down due to the pandemic. And just when we thought cancer was the worst thing that could happen to us, here's a bigger challenge happening to everyone around the world. During the lockdown, a lot of hospitals and clinics were closed to cancer patients. Surgical procedures and treatments have been postponed. So only emergency cases were entertained and some cancer treatments pushed through, but a lot of patients were afraid to go to the hospital. And even if they wanted to, there was no public transportation. And even now, as the quarantine levels have changed, there are some transport, but not a lot. So, and even when it goes full blast, we're wondering, is it going to be safe to ride a crowded bus or a crowded jeep? Maraming pagsusubok talaga ngayon ng mga pasyente, lalo na yung mga nagkikimo, nag-radiation, or nag-aantay ng operasyon. But as in the way we deal with cancer, the best way to beat the fear is to know more about the disease. And Dr. Tiangco will help sort out all these things for us. And we thank her for her time and her wisdom. Just to let you know, I Can Serve will always be here to hold your hand, COVID or no COVID. If there are other topics you want us to take up, just send us a message and we'll tackle it and have another online conversation. Meanwhile, enjoy this chat and thank you for being with us. Please stay safe. God bless all of you. Nicoy?
All right. Thank you very much, Cara. Okay, so let's start the ball rolling now with our speaker. Just a very simple introduction. Okay. Our speaker, Dr. Beatrice Tiangco, is an oncologist and epidemiologist. She is a co-founder and CEO of Cancer Care Registry Philippines Foundation, a member as a board of directors of the Medical City, and a member of the board of directors of the Cancer Commission of the Philippine College of Surgeons. I was looking through the group chat and I Can Serve, and we also have sisters that have her as their oncologist. So without much further ado, my dear sisters, ladies and gentlemen, our source speaker for this afternoon, Dr. Beatrice Tiangco. Take it away, Doc.
Thank you, Nicoy. Salamat. Thank you, Cara. Thank you sa lahat po na nakikinig ngayong hapon. Isang oras po tayong magsasama. Naghanda lang po ako ng konting presentation. I really have only, I think, 20 slides. And if I stick to the rule of 1 minute per slide, and baka faster pa nga kasi I'll be reading some of the slides, I hope we'll have the chance to talk further at the end of my talk. Ang title po na binigay ko sa talk is The Second Big C. Mainly because alam naman natin lahat kung ano yung first, di ba? Kasi yung first big C, naranasan na ninyong lahat or karamihan sa inyo. So yung unang big C po, na may binansagan na nga po ng big C, that ay cancer. Big kasi it tends to overshadow a lot of things in your life if you have been diagnosed with cancer. So, ang pangalawa naman na may malaking shadow din na nag-iba po ang buhay natin is COVID. So, that's the second big C. Naghanda lang po ako ng ilang slides about questions that have been asked of me as a medical oncologist and as an epidemiologist. So just to explain, yun pong medical oncologist, of course alam nyo na, siya po yung nag-aalaga ng cancer patient. Ngayon, ang epidemiologist naman po is more like a researcher at or kung nag-aalaga man siya, ang inaalagaan niya or ang pinag-aaralan niya is populations of patients. So not individual patients, but a group of patients, like a group of cancer patients or a group of COVID patients, and we try to understand the illness and how it affects a specific population. So, umpisahan ko na po ang unang tanong na ihinanda ko po para sa inyo dahil naririnig ko na rin po sa maraming tao. Are cancer patients at increased risk of SARS-CoV-2 infection? So para po malaman ang sagot dito, maghahanap po tayo ng kaalaman na galing po sa mga scientific journals. Although madali pong, kung huhula talaga ako, huhulaan ko na talagang mas susceptible po ang mga pasyente may cancer sa COVID compared to those patients na wala naman silang cancer, wala naman ibang sakit. Unang-una, dahil naririnig naman po natin na yun pong mga may high risk na COVID, yun pong may mga comorbid illness like diabetes and hypertension. How about those with cancer? So, tingnan po natin itong pag-aaral na ito na na-publish po sa Journal of American Medical Association noong March 2020. This was done, it's a retrospective study. Ibig sabihin po, tinignan po nila ang medical records ng 1,524 patients with cancer who were admitted to the Department of Radiation and Medical Oncology doon po sa hospital sa Wuhan University. Doon pong 1,524 patients po na ito, na-confine po sila sa Wuhan University Hospital mula December 30, 2019 hanggang February 17, 2020. So, nung tinignan po nila ang clinical course based po doon sa mga records ng mga pasyenteng ito, nakita po nila na ang estimated infection rate of SARS-CoV-2 patients with cancer was 0.79. No? In other words, 12 of the 1,524 patients ang cancer patients ang nagkaroon po ng COVID. Ulitin ko po, only 12 of the 1,500 patients, cancer patients who were confined also had COVID. That gives it a 0.79% infection rate. However, they had, of course, to compare this to those patients na wala naman cancer. Nakita po nila na this was higher, the 0.79% was higher than the cumulative incidence of all diagnosed COVID cases that were reported in the city of Wuhan. Kasi po, during the same time period, there were 11 million people in Wuhan, living in Wuhan, and of these 11 million people, 41,000 of them had COVID or were infected with COVID. This gave an infection rate of 0.37, which is lower than the 0.79% infection rate na nakita po nila sa patients with cancer. So, even if madaming pasyente po ito, no, out of 11 million, 1,000 ang may cancer, 1,500 ang may cancer, tapos 12 ang nagka-COVID, hindi pa ho rin tayo pwedeng mag-conclude necessarily, absolutely, na talagang mas susceptible po ang pasyente may cancer sa COVID. But it is enough for us to make this hypothesis. It seems that patients with cancer may be susceptible to an infection during a viral epidemic owing to their immunocompromised status. So, they noticed that they did not put they conclude. They said they advise. The author's advice is, we propose that aggressive measures be undertaken to reduce frequency of hospital visits of patients with cancer during a viral epidemic going forward. For patients who require treatment, proper isolation protocols must be in place to mitigate the risk of SARS-CoV-2 infection. So that is the answer to our first question. Are cancer patients at increased risk of COVID infection? The answer is, it seems yes. However, take note that it is less than 1%, is only 0.79% chance of infection. How can a cancer patient protect himself from COVID? If you have active cancer, meaning if you have just been diagnosed or are undergoing treatment or are not in remission and are under active observation, stay home unless it is necessary to leave the house. Once outside, wear a mask, practice social distancing, hand wash with soap and lather for 20 seconds 5 times or more a day, drink at least 2 liters of water a day, be active, wag pong nakaupo lang, wag lang pong manood ng TV, exercise regularly, eat healthy, and it's okay po naman to drink vitamins like vitamin C and zinc and fish oil, and we'll be discussing more about this later on. Aside from wearing a mask, should we also wear a face shield or goggles? Face shields and goggles, diba, nakasuot tayo yan, ano? Prevent the virus from another person from transferring to your mouth, nose, and eyes, which are the portals of entry of the virus into your body. So pagka may virus dyan, paano po yan papasok sa inyo? Pwede po yan dumaan sa mata nyo, kung wala kang salamin or goggles. Pwede dumaan sa ilong pag hininga nyo. Pwede po yan dumaan sa bigbig. Kunyari po, tumawa po kayo or ang lakas ng hinga ninyo, no? Tapos sabay may virus na nag-sneeze po around you, no? So these are what's called the portals of entry. Note how you cannot unintentionally touch your face if you have a face shield on, and you cannot touch your eyes with goggles on. So ako, hindi ko matouch kahit hindi ito goggles, no? Or kung may face shield po, hindi ko siya pwedeng in-touch unless sinasadya ko. Kunwari nangati ako, iaangat ko yung goggles para po maabot ko. So, marami po kasi, napansin po nila, bago pa magpanahon ng COVID or infection, unconsciously po, we like touching our eyes, we like touching our face, no? But if you have goggles and face mask on, napakahirap gawin to unless talagang sadyain mo. So these are really your protection against your unintentional touching of your face and against the virus from entering the portals of entry, which I mentioned earlier. So even if the virus is in your hands, in between your frequent washing of hands, the virus is prevented from entering your body. This may be more useful for those who have to interact with people in their daily lives and touch others, like for example, the doctors in the audience or the nurses in the audience. Very useful po sa kanila ang may suot po ng goggles and face mask and shield, no? Or those who work in public places like gasoline boys or sellers in the palengke. Pag nasa public po, mabuti na po yung talagang siguradong protected kayo. Always wear your mask. If you have to go to high-risk situations or high-risk places, wear goggles and face shields. So this might be a good idea to do if you need to go to the hospital for chemotherapy or radiation treatment, but this is not really required. Do I really need to have my chemotherapy and radiation treatment as scheduled? I'm pretty sure marami po sa inyo na nag-undergo po ng active treatment or nagre-radiation have asked this question to yourselves or to your doctors, no? Kasi when we meet our patients and we plan the treatment plan, parati namin i-emphasize na mahalaga po na we keep to that schedule, we keep to that treatment plan. Pero napasukan naman po tayo ng isang bagay na COVID na hindi naman po natin inaasahan. Medyo sira po lahat ng plano natin, no? So, anong gagawin natin ngayon? The risks and benefits of following the agreed upon treatment scheduled prior to lockdown, now, after quarantine has been eased, so wala na kasi general quarantine na lang, should be discussed with the attending physician. Each patient is different, and one may be more concerned about the risk of cancer being reactivated, while the other may be more concerned about the risk of getting infected with COVID, because these are two very real risks. In general, oncologists first make sure their place of practice is taking precautions about the spread of the virus within, because doctors and nurses and healthcare workers would, of course, rather not go to a place of work na hindi naman din pala nag-iingat or hindi linilinis regularly or hindi nagtitake ng precautions. Because, of course, tao din sila. And because they are also at risk. Then once they are assured and go back to the hospital, then they reassure their patients that the hospital is doing what it can to prevent virus spread from within. Since the virus is invisible and the hospital is open and not in lockdown, no one can promise there is no virus in the hospital. So just as a summary of the first few slides, perhaps I should emphasize prevention. No? Prevention is key. So how do you prevent? Wear face mask, wear face shield, wear goggles, but most especially face mask. And remember, it's not really the healthcare worker that is the frontliner. You are the frontliner. You are the one standing in front of the virus and being infected, and the one beside you, no, and people at your house. So you are the one stopping the spread of the virus. Preventive steps that can be done while you are not sick with COVID: control your comorbid illness, whether it's diabetes, hypertension, or your cancer. Exercise regularly. Avoid stress, if that's possible. And yes, it's possible. Get enough sleep. Eat well-balanced meals. Drink omega-3 and vitamin and mineral supplements. As I said, they will not harm you. And drink 2 liters of water a day. So what do you do if you do develop symptoms at home? Consult your family medicine or internal medicine doctor. Get some more rest. Drink high dose of vitamin C and zinc. The evidence for this is anecdotal, but there exists some evidence. Drink 2 liters of water a day. Take your temperature 2 to 3 times a day. If your temperature is above 38 degrees, take BioFlu or Biogesic 3 or 4 times a day as needed, and take your mucolytic if you are coughing. When preventive measures fail, how do you decide if you need to be tested? Supposing you develop cough and cold and fever, it's flu season ngayon, how do you know if it's just the flu or it's COVID? You have to ask your doctor what to do. And if your symptoms worsen, hindi mo makausap pa yung doctor mo, mas maganda sana kung meron po kayong paraan of taking your oxygen using the pulse oxygen, yung parang sipit, no? Normally po, ang ating oxygen, 99, 98, 99. Pag nakikita po ninyo na habang inuubo po kayo or kahit walang ubo, bumababa to less than 95, that's the time you should go to the hospital emergency room and have yourself tested. So where do you go and what happens after you are tested or swabbed? You get your advice from your doctor, of course, and ask for the request, or you can just walk into the emergency room. You, if possible, call the hospital first and ask if they have a PCR test available, and then go there to be swabbed, kung available. You will be assessed at the emergency room, and you will be advised whether you should be admitted while waiting for the swab result, or if you can go home, or if you need to go to a quarantine center. So, how about in terms of mortality? Which has more fatalities, COVID or cancer? Can you cite figures and timeframes? So this was a question that was given to me. Why do you think this is so? So first, I'd like to show you here the information about COVID. No? So we're all familiar with this. Many of us follow this every day. This was as of June 10. There were already 23,732 total number of COVID cases. There were 1,027 deaths from COVID. And if you look at the active cases, so those are the 23,000 minus the recoveries and minus those who have died, you are left with around 17,000 active cases. And you will see here that they all have what's called mild disease. No? 94% of the time, it's either mild or asymptomatic. No? Walang symptoms. So let this be reassuring to you that even if you do get it, and even if you have cancer and you get it, chances are 98% of the time, it will be mild, maybe even asymptomatic. And again, 0.4% lang po ang severe and 0.1% lang po ang critical. Kung titignan po natin yung case fatality rate, 1,027 deaths out of 23,732 cases. That gives it a 0.04 or 4% case fatality rate. So let's compare this with cancer data of 2018. So I got this from the Global Cancer Network website, and you'll see here that there were, in 2018, the new cases of cancer was 141,021. Also in 2018, the number of cases who died of cancer was 86,337. And the active cases of cancer, which includes the new cases plus those who were diagnosed earlier and are still alive, the prevalence is 291,781. If you use the same calculation, use the same formula, of number of deaths over number of active cases, you will see that the case fatality rate of cancer in 2018 was 30%, much higher than the 4% of COVID. Can you compare the two diseases in terms of severity of symptoms? So one similarity between cancer and COVID is that they can actually have no symptoms even if the virus or cancer cell is already alive in the body. When it does cause symptoms, it can be localized, meaning affect only one part of the body, like the lungs for COVID, or the breast for breast cancer, or systemic, meaning it can cause symptoms in many parts of the body. And some of us have heard of how patients with COVID all of a sudden have hypotension, high-grade fever, need the ICU, have heart failure, because very rarely, but it has happened that it can have systemic symptoms upon presentation, ICU agad. Even in cancer, some of us, unfortunately, perhaps some of you here, were diagnosed with cancer, stage 4 na. Many times, tinatanong, ba't nangyari yun? Paano po nangyayari yun? Bakit hindi ko alam? Unfortunately, cancer, breast cancer, even breast cancer can present that way. Do you think COVID is said to be worse than cancer because COVID is contagious and cancer is not? Why or why not? So it depends on what you mean by worse. So you could say that COVID is worse for the general public because it can be passed on from one person to the next. And those who are sick are physically isolated from those who they can infect. So yeah, this is bad, no? So in that sense, COVID is worse than cancer. Cancer is not communicable, and so cancer patients can stay physically close to their loved ones. It is still a very isolating disease. That's what my patients say, because what an individual patient is going through is not experienced nor understood by others who have not had their lives threatened by cancer. So it's important, and I'm glad more and more patients with breast cancer or cancer are joining support group kasi doon po nagkakaintindihan at nakakashare po ng experience about what it feels like and what it means to you to have this diagnosis of cancer. Which one is easier to treat, COVID or cancer? There is no known treatment for COVID. It's a viral illness. You may hear remdesivir maybe, but really it's not a treatment, it's not a cure. It has a natural course, which once finished, the host or the infected person usually remains alive, as I mentioned earlier, 95–99% of the time, and hopefully even immune from getting it again. However, this has not been proven yet. Cancer is difficult to treat because it starts from a cell which once was normal and recognized as self by the body. The immune system is blind, no, to the cancer cell and cannot recognize it as harmful to the body right away. Kasi doon nanggaling eh, doon siya tumubo. Ang sarili mong katawan ang gumawa ng cancer cell. Only when it forms a mass, which is clinically detectable, or when it causes one of the 10 warning signs of cancer, will the person hopefully decide to undergo tests to find out if he or she has cancer or not. Once diagnosed, it is also often difficult for the patient to accept this diagnosis and to have herself treated. Which one takes longer to treat? Now, there is, as I said, no known treatment for COVID. So, in one sense, it is the body's own immune system that treats COVID or gets rid of it faster if the person has a strong immune system. Slower or not at all if with the immune system weakened by uncontrolled or comorbid illnesses. So napakahalaga po talaga, not just against COVID, but also against cancer, that we have a strong immune system. The length of time for treatment for cancer depends on the stage. Some stage 1 cancers can be treated in the same time it takes to remove the small mass. Like if you have a 1 centimeter ER positive HER2 negative cancer of the breast, pagtanggal po ninyo, pwede na po kayong cured nun. While stage 4 cancer can require lifelong treatment like other chronic diseases like diabetes and hypertension in order to control the disease, but not necessarily to cure it. Now, which disease makes more people sick and why? So I showed you earlier about how many more patients with cancer are diagnosed every year compared to the number of patients that have been diagnosed in the past 3 months. No? But again, it's an ongoing illness, so unfortunately, it's possible that baka lumampas pa ho sa dami ng patients na with cancer ang ma-diagnose with COVID. Pero wag naman sana. But both cancer and COVID can be in the body and not cause symptoms nor make the person sick. So ito po yung mga asymptomatic carriers. But both can also have a bad case of the disease, causing multi-organ failure, suffering, and death of the patient. Why do more people die of cancer than of COVID in the Philippines? Because the COVID virus infecting a person has a lifespan of less than a month, and it dies on its own, even without treatment, usually in 7 to 10 days, while a cancer cell hardly ever dies on its own. It does not know how to die. That's what makes it malignant. And only surgical removal, chemotherapy, or radiation can kill it. Because many more people are aware of how COVID spreads and how to prevent oneself from being infected, and less people know how cancer develops in a person and what can be done to prevent this, this is one reason perhaps why more people die of cancer than of COVID. I think if there is one message that I would like for all of you to remember, is that cancer can be prevented. And if we only knew how to prevent cancer the way we now know how to prevent COVID, and if only it were as simple as wearing a mask, but unfortunately it's not, then perhaps less people would be diagnosed with cancer and would die from it. So this is a task and a challenge for all of us still alive and joining the fight against cancer. So how does one get infected with COVID? And so therefore, if you know how you get infected with the COVID virus, then you can prevent it. So far, what we know is, regarding COVID, successful infection has to do with the exposure to the virus and the time that you are exposed to the virus. So these are scenarios wherein there's what we call low risk of getting the virus. Supposing you are in the vicinity of someone far away, more than 6 feet away, there is low risk if you limit your being outside for less than 45 minutes. Even if you assume everyone in the world has a virus, is asymptomatic and has COVID, if you stay outside and you limit it for less than 45 minutes, of course with a face mask on, then you have a low risk of getting the disease. If you talk with someone face-to-face with your mask on, it's also low risk if you limit to less than 4 minutes. Yung nag-uusap po kayo, less than 6 feet para magkarinigan. Kung saglit lang po kayo mag-usap, kahit po may COVID siya at naka-face mask kayong dalawa, low risk po of getting the virus. If you're jogging and someone passes by you in open air, low risk din po yan. If you go to well-ventilated spaces and practice distancing, again with limited time of exposure, that is low risk. If you go to the grocery, this can be medium risk because there are people in the grocery, and because you don't know people have been touching it and putting back on the shelves the things that they have touched. Hindi naman po lahat naka-gloves. So you can reduce your risk to low risk by limiting the time and by following hygiene. So when you come home from the grocery, disinfect, wash your hands, clean everything you bought, take a bath, etc. What are high-risk situations or scenarios if you stay indoors for a long time and it's not your home and you don't know how clean the place is or who have been there? If you use public bathrooms or common areas, if you go to restaurants and it's air-conditioned and, tabi-tabi, but you can reduce this to medium risk if you sit outdoors, with distancing, and you avoid touching surfaces. Very high risk if children were sent back to school, that would have been very high risk. Kaya po walang pasok. Weddings and parties, in the beginning, hindi pa natin alam. So there were several victims who succumbed to COVID because they had gone to weddings or even to funerals or parties. Business networking and conferences, very high risk kasi air-conditioned and sometimes thousands of people attend conventions. So tanggal na po lahat ng convention this year. And cinemas, concert, and arenas, very high risk. So in other words, what are the risk factors? The bottom line factors you can use to calculate your risk are whether you go indoors or outdoors, if you have narrow spaces or large ventilated spaces, if there's high people density or low people density, if you're going to be exposed long or just for a brief period of time. The risks will be higher if you go for former scenarios, if you stay indoors in narrow spaces with lots of people and you stay very long in that place. So what can I do to prevent cancer or to help me live well with cancer? And perhaps also with COVID. But here, this is a book kasi that I know the author. I knew him personally before he passed away. He had died of brain tumor, a tumor that really has a very short lifespan. However, he lived for more than 20 years. And during those, he was a physician, a member of Doctors Without Borders. I met him when I was training in Pittsburgh, and he was very helpful to me and to my family. No? So he wrote this book when he was sick, and he shared everything he learned about the anti-cancer way of life. It was a new way of life which he practiced and allowed him to live for a very long time, even if he had brain cancer. So he says here in the beginning, all of us have cancer cells in our bodies, but not all of us will develop cancer. So what does that mean? So what are the small changes that you can do that can make a big difference in your life? So this is a question that Dr. David Servan-Schreiber asked and answered. So in that book, you're going to see it. He says, protect yourself. Again, prevention, protect yourself. Avoid pesticides, insecticides, chemical cleaning, and products. Always focus on having good food and drink and a healthy lifestyle. Balance your diet, and we'll talk more about this later. Be active, and I cannot emphasize it enough. Practice 20 or 30 minutes of physical activity every day. Expose yourself to sunlight for at least 20 minutes a day for your vitamin D dose. Natural lang po yun. Free yourself of feelings of powerlessness. I think this is important, something that very few people realize, but the experience of powerlessness, I believe, is something that many patients with cancer have experienced. And he says, resolve past traumas, accept and control your emotions, learn to accept fear, sadness, and despair, and then let go of these emotions so that they no longer have a hold on you, and find someone to share your feelings with. So this is his best advice. And meditate. So again, what does, for example, meditation or getting rid of the feeling of powerlessness, how does that affect your immune system? What inhibits and what activates immune cell production? So what inhibits immunity or stops it or makes you more susceptible to illness? This is him, and he has sources in his book. And the reason why I mention it more than any other, because I read the book and because I know the person and I trust him. So you should know that. So he says that traditional Western diet is a pro-inflammatory diet. So apparently nowadays, more and more, it's the inflammation that causes problems, that causes disease. It's the inflammatory reaction that becomes the body's main source of disability and illness. So what inhibits your immunity? If you always have the traditional Western diet, if you always have stress, anger, and depression, if you're socially isolated, which unfortunately all of us are nowadays to a certain extent, if you deny your true identity, for example, if you deny your sexuality, or if you have a sedentary lifestyle. What about activation? So what activates immunity? The Mediterranean diet or the Indian cuisine, which are anti-inflammatory, and serenity and joy, support from family and friends, acceptance of yourself, your values, and your past history, and regular physical activity. So more and more, paulit-ulit na lang po yung ibang slides, pero malapit na rin po tayo matapos. What foods inhibit the cell cycle growth? So I got this, I took a picture of one page of the book. There's a pamphlet in there that for breast cancer, because I know a lot of us, of the audience have had or have breast cancer. So the ones on top are the ones that can inhibit the cancer cell from growing. So you want to have more in your diet: garlic, leeks, spring onions, Brussels, Brussels sprouts, cauliflower, cabbage, and kale. And then in the bottom, the food that you don't want to eat too much of is romaine lettuce, fennel, chicory, tomatoes, carrots, bok choy, and aubergine. Okay, hindi naman po bawal. Wag po kayong magpanik kung kaninang lunch kumain po kayo ng lettuce or tomato. That is not the point of this slide. The point is there are certain foods that you perhaps want to have a little bit more of because studies have shown that these are going to be of benefit to your immune system. And others naman that you might want to eat less of. Pero wala naman hong masamang nangyayari pag kumain ho kayo paminsan-minsan. So what are the tips from cancer patients on how to live a full life while it is under threat? So this I've learned, although I made the slide, I've learned this from my practice of over 20 years of listening to cancer patients, taking care of them, and going with them through their journey called cancer. And those who I think are at the best of health, even with their diagnosis of cancer, are those who accept that your health is under threat, understand the situation and learn how you can avoid getting sick with COVID or cancer, and how to live among people who have it and may give it to you. Let go of things that you enjoyed but are not absolutely necessary or may put you at risk, but now could threaten your life. Try to define your comfort zone and work or live well within this safe zone. Join clinical trials to help gather evidence for effective COVID or cancer treatments, and make decisions based on facts, not on fear. So my last slide has to do with this. It's about fear, and how it can paralyze us. And if I can refer to Marie Curie, who was a Nobel Prize winner in physics and chemistry in the 1900s, she said, "Nothing in life is to be feared. It's only to be understood. Now is the time to understand more so that we may fear less." So with that, I hope I was not cut off or my internet was clear. That's my last slide. And back to you, Nicole.
All right. Thank you very much, Dr. Trixie. I know ang dami nating natutunan doon. Ako, long-time cancer survivor already. Yes, I had a recurrence the last 5 years, but yeah, ang dami pa rin. And even if you say na paulit-ulit yung mga sinabi ninyong reminders for us, I think it was actually a good reminder kasi we do tend to forget or something lang to boost us na parang we're doing something right din naman pala. Okay, so now po, Doktora, though marami nang nasagot na questions kasi we had, some already sent questions already prior to your talk this afternoon na nasagot naman po ng slides ninyo, ng presentation ninyo. There are still some questions here that gusto pa rin po nilang ma-clear sa inyo. So, yeah. One of it is about mental health. Kasi po, because of COVID plus cancer, meron dito ang term niya, nababalisa po siya talaga. So what's a good way kaya to cope with that?
Pagkakaintindi ko sa balisa is uneasy, di ba?
Apo.
You're not comfortable in your own skin where you are. And there's something bothering you. You don't know exactly what it is, but you know that you're at peace. Balisa. Hindi lang naman po yung ating nagtanong, napakarami at lalong dumami po nung nagkaroon po tayo ng ganitong threat ng COVID. At hindi lang po patients with cancer, but those even without any problems before, all of a sudden needed to stay home, had a change in lifestyle. Ang natutunan ko po sa mga spiritual guides, is accept, adapt, and transcend. Yun po yung gusto ko i-share. Perhaps there are things that the person who asked or yung mga nababalisa, tumingin po tayo sa loob natin, ano po ba yung mga bagay na hindi pa natin matanggap o natatanggap? Siguro, kung pwede, intindihin natin, di ba? Sabi ko ng last slide, understand it, why, and then accept it. Don't fight it. Nandyan na yan. And then adapt to it. And I gave tips on how to adapt to new situations. That way you can go above it and transcend it. These are words that are easy to say, but many times when you cannot do it alone and you need help, there are phone numbers, telemedicine numbers for psychiatrists and psychologists. They're also out there. If you, some of them are actually free. But if you're not comfortable speaking over the telephone or Zoom with a stranger, you're going to have to look for your best friend. Or maybe the best friend is in heaven, but it has to be shared.
All right. Okay, so isa pa pong question, at ito marami ho talaga ang nagtatanong. Is it safe for patients with history of cancer to go to hospitals right now to perform annual laboratory tests for monitoring? Meron nagsabi na naabutan na po siya ng lockdown but yung prior niyang check-up, meron pong calcification. So what he's supposed to do? Pwede na po ba kaming magpunta for our check-up? Yun po.
Okay. Ang sagot dyan, yes. But the hospitals also are now aware of that concern of everyone out there who need a wellness checkup, and kasi annual, no? Pagka naman po walang bagong nararamdaman, and it's, for example, an annual screening for breast or mammogram, for example, pwede naman po dahil hindi, as I said, di ba, sabi ko ng unang slide, if you don't have to go out of the house, wag na lang muna. Pero, and so yung pag-screening or wellness check-up, hindi naman po yan urgent or emergent, nagawin exactly on the 12th month. So, pwede po after another 3 months or at the end of the year. But if that's something that, for example nga, may calcification and you don't know what that means and you want to know if it's still there, many hospitals po ngayon, pumapayag na po ng teleconference or yun pong yung laboratory na lang po ang pupunta sa bahay ninyo. Tapos yung results po, padadala na lang ninyo sa doctor ninyo para pwede nyo pong pag-usapan yung results ng lab test without you having to come to the hospital. But again, if you have to, or if you really want to, you don't have to, but you want to see your doctor face-to-face, ayaw mo yung sa email lang or internet lang, safe naman. Kasi lahat kami, ako pumapasok na kahit hindi ko naman kailangan. Because I know it's safe. And I wear my face mask talaga. And, I follow all the advised precautions.
Yeah, so very practical po, no? We really have to follow all the protocols na sinasabi in all the public places, especially for us na nagka-cancer na. Yun po. All right. Oh, meron pang hindi naman to question. Shout out lang po, Doc. Tulad nga sinabi ko kanina, ang daming sisters na kayo po ang oncologist. Meron po dito Annalisa Collado. Hello po, Doc Beatrice. Kayo po ang oncologist ng mother ko. Ayan. Ang dami po natin ganyan. If I'm not mistaken, even si sister namin na si Cecil Ronquillo and another one in their convo. Kayo daw po ang oncologist nila.
Sabay po kami.
Okay, meron ho dito.
Sabay kami
okay. Sige. So, isa pa po. Travel. Okay. Yun. So, alam ko po, nagsabi na po kayo about diet, yung mga dapat kainin at yung mga dapat bawasan. Pero ito ho, just particularly for the I Can Serve Sisterhood po, talagang kailangan hutong tanungin. Ano po ba ang say ninyo sa sugar, sa diet ng mga cancer survivors, lalo po na ngayong COVID? Kasi po, aminin natin, ngayong COVID, gusto po naming mag-feel good. And madalas po, yung dessert po yun, yung ice cream. Kaya lang, sugar nga po. So, paano po namin yun ibabalanse kaya, Doktora?
Yung sugar kasi, I think yung diabetics, yun may uncontrolled sugar, tumaas talaga ang risk nila for high risk sila for COVID death. We don't want to be a diabetic uncontrolled sugar. But one cake will not make you a diabetic. One piece of cake will not will not put you in danger. Diba? Kung meron lang sanang way na ma-check mo yung sugar mo, pero kung hindi ka naman diabetic, you don't need that. Ako, wala akong ganon. So, pwede po yung unti-unting sugar. Wag lang po yung isang buong cake ubusin ninyo.
Okay. So that's a nice consolation for the sisterhood na talaga namang hindi po matigilan, no? Tsaka yun nga po during this time of COVID, there are some foods talaga na talagang it makes us feel better, na nawawala yung anxiety. So, yan, sisterhood. Okay lang po tayo dyan. Yan. Other questions? I think nasagot naman na po ang practical to the leadership ng I Can Serve. Anyone po? Cara, Crisan? Anyone?
Somebody was raising his hand from the chat. Okay. Si Mr. Jerry.
Hi, good afternoon po.
I muted him.
Pwede po magtanong?
Go ahead po, Mr. Jerry.
Oo. Doc, good afternoon. Thank you so much for having me here. Yung aking mother po kasi na-diagnose ng may invasive carcinoma, breast cancer po. E ngayon dahil nga po nag-lockdown, supposed to be, hihingi pa lang po kami ng mga clearance kasi nagpa-check up siya, laboratory, tapos yung sa heart niya, kasi 70 years old na siya. Ngayon, sabi ng surgeon, need daw talaga siyang tanggalin yung kanyang breast, right breast. So, yun po yung procedure na gusto niya. Ngayon, ang naging challenge po namin dahil naabutan ng lockdown, hindi na po kami nakabalik dun sa doktor. Parang iniisip namin na sana nga bago mag-undergo siya talaga ng check-up, magbigay ng operation, may plan po sana kaming punta sa ibang doktor for second opinion kung yun po talaga yung dapat. But I heard kanina parang pag talagang may cancer, kailangan niya tanggalin. And then after the po noon, kasi mag-undergo din daw siya yata ng chemotherapy. Kaso yung mother ko po kasi medyo, syempre matanda na, minsan hesitant siya, minsan nagdadalawang isip. So, tapos nung nakuha po namin yung mga laboratory niya, yung iba naman okay lang po. Kaso kailangan namin ng tawag dito, yung sa cardiologist na recommendation na mag-go na siya talaga or clearance para mag-go na siya dun sa kanyang operation. If that is the case po, ano po kaya yung pwede nyong i-advise sa amin right now? Mag-go na po ba kami doon or gusto ko kasi namin makarinig rin sana ng second opinion at pumunta rin talaga sa oncologist kagaya niyo po.
Jerry, na-biopsy na ba?
Hello po. Yes po.
Na ba siya?
Opo, na-biopsy na po siya eh. Yun po yung lumabas sa biopsy.
Alam mo ba kung ERPR, yung mga ganong biomarkers? At saka na-stage alam mo ba kung stage 1, 2, 3, or 4?
Hindi po niya sinabi kung anong stage eh. Pero wala pong nabanggit kung anong stage. Parang sabi nung kung hindi, if I'm not mistaken, parang 1.
Okay.
Kasi yung mother ko ngayon, parang okay pa naman siya. Pero yun nga, minsan kasi may parang konting pain doon sa kanyang breast.
Pagka yan stage 1, hindi pa siya gumaling ng stage 1, surgery lang talaga ng gamot. Hindi necessary therapy susunod. Pero hindi ko pwedeng sabihin niyan for sure kasi halaga malaman. Katulad ng tao, kilalanin mo, yung cancer kinikilala din yan eh. Kasi may cancer na matapang eh. Kahit maliit na kailangan ng chemo after surgery. Meron din naman po na mabait na cancer na kailangan na wala nang gagawin pagkatapos ng surgery. Hindi ko pa alam ang ating anak kung kung mabait or matapang yung napunta sa nanay mo. So tama yung ginawa nyo na unang-una, diagnosis, correct, biopsy. Second stage, you have to be sure na stage 1. That's what I mean when you have to understand. Ano nangyari sa nanay, you have to understand. And if you're in a stage 1, that's good. And then after surgery, again, understand, maliit ba siya or matapang na yung cancer. Then, if you decide na ayaw na yung doctor,
So, Doc, pwede na silang pumunta ngayon for second opinion? Meron ng nagki-clinic po?
yes, marami ng doctors na nagki-clinic, marami na rin ang gumawa ng schedule sa teleconference. I-encourage nga na mag-second opinion through tawag lang, if you send your results. Minimize namin yung pagpunta sa hospital.
Doc, pwede po ba sa inyo? May magpa-consult?
Oo, pero hindi ako pwede mag-advertise na schedule ko dito. Baka pagalitan. So siguro ipapasok.
Kasi gusto talaga namin, opo, na talagang mag-consult sa... Una gusto ko kasi parang yung babae talagang daw doktor. Tapos oncologist din para yun nga kung talaga magpo-process, mag-undergo na siya ng ano. Then kung yun pa rin yung kanyang advice, so babalik po kami doon sa surgeon para ano kasi dito po kami sa Muntinlupa eh. So
tama again Jerry yung ginagawa mo. In fact, if wag naman sana, but if I were to be diagnosed as a loved one with cancer, the first thing I do is get a second opinion. Kasi important the diagnosis. So, details I can serve, and if you go back to their Facebook in a while or allow, that's how you can perhaps get in touch with my
Yeah, Jerry, i-chat box namin privately to you ang contact information ng doktora so you can send
salamat po.
biopsy results. Okay, sandali lang. O, i-mute na kasi meron pang ibang tanong matapos yung oras.
Yeah, thank you.
Okay. Yeah, sige. And then, meron pa po tayong question dito. Medyo na-address na po, Doktora, to, but I would just like to reiterate. Nahihiya po ako magtanong, pero if ever, pwede, I'm curious about how big is the role of support groups and communities right now?
You're asking me. Like the reason I'm stating this because I am not a member of a support group. So from my point of view, from a doctor's point of view, when I see like patients who belong to support groups, some are, may personality ang tao, di ba? Alam niyo naman yan, tagal niyo ng support group eh. There are those who thrive in it. There are those who, for example, get scared when a member of the support group has some bad news, no? And so I'm saying is, I'm guessing it's not for everyone, but those who are in support groups who are very supportive of each other and who help each other, very, very, very important. Lalo na po yung, for example, the patient coalition that helped with the creation of the implementing rules and regulations of the National Integrated Cancer Control Act. In fact, it was the Cancer Coalition that, which is a group, an organization of a lot of patient organizations or support groups. Sila po yung talagang tumulak. Kasama na dyan si Cara, na magkaroon po tayo ng cancer law. No? And maybe it's just taking a little bit of time for the cancer committee, National Cancer Committee to be formed, but ang ganda po ng law, very favorable to cancer patients. And it was the support groups that did this, a lot of it, a lot of the work. So kudos to the support groups, no? Including I Can Serve, of course.
Yan. So we're open for volunteers, and if you want to join I Can Serve, pwedeng-pwede rin po. Just message us on Facebook. All right, another question po, Doc. I am taking tamoxifen right now, very specific tamoxifen. Does it affect my immunity?
Okay, you are on tamoxifen for a reason. And the reason is it prevents or it stops your cancer from coming back. I don't know exactly your situation, but it is on the side of anti-cancer. So then it cannot be anti-immunity, right? Because it's stopping cancer, which is the biggest enemy of your immune system.
All right. Okay.
So no, it doesn't affect your immunity. Okay.
It doesn't.
Sorry.
Yeah. And then on remission naman po, Doktora, there are some doctors who say that cancer just rests but cannot be cured. Yet you say cancer can be cured po.
Yeah, some cancers can be cured, others will just go to sleep. And these are things that are hard to accept. Remember, I said accept, adapt, and transcend. But having said that, there are people who were informed that their cancer will just go to sleep and go in remission and possibly wake up someday, eh hindi naman gumigising. Right? So don't let that information, you adapt to it. Don't just let it get you down. Don't be powerless when you hear such things. These are things you have to hear so you can adapt and you can transcend.
Okay. So babalik na naman tayo dun sa sinabi ni Doktora kanina, adapt and transcend. Okay. Yeah. And then ito po particular din po sa diet, is fructose from fruits also to be avoided? Can I take green tea during chemo? So fructose and green tea po.
Wala po akong naririnig na nakakasama po o ikamamatay po ninyo pagka po kayo kumain ng fructose or green tea during chemo. So my answer to that is go ahead. You can drink green tea.
Go ahead. Okay. Green tea. Okay. Kasi fructose, alam ko po, nasa milk tea yan. Eh, lahat po nagmi-milk tea din ngayon. Yan. Okay. Ano pa ba? Are there any more questions sa iba ko pong kasamang nagmo-moderate? Leadership ng I Can Serve, meron pa po ba? Because halos wala na po akong
Just
questions.
for Doctora's information, there are about 88 watching on Facebook, plus the 30 on the Zoom meeting. So for 100 now. And video will be accessible.
Parang nagtataas ng question si Arlene. Dito nakikita ko sa screen ko. Can you
Wala.
Arlene, naka-mute ka.
Hi. Okay.
Okay.
Hello?
Yeah.
Okay. Hi, Doc.
Okay.
Good afternoon. Sabi niyo po kanina, if you must leave the house, at least limit po yung time na paglabas nyo. Kasi right now, I'm working in a hospital, although sa admin ako. But then, right after nung nag-declare nung lockdown, hindi na rin talaga ako pumasok. Kasi nga, I'm not comfortable. Although, I'm in remission for 8 years na right now, kaya lang, feeling ko, yung susceptibility ko, hindi ko alam kung ano ba yung, asan na ba yung status ng immune system ko right now. So, what do you think? So, since March until now, hindi na ako pumasok.
Pumasok ka na!
Ayun. Pwede na, Doc.
Okay ka na.
Pwede na. Okay. And then, kasi overdue na rin ako nung, I still undergo yung every 6 months na solidronic infusion. So, I'm due for that last month. Plus yung other laboratory ko. Eh, dahil nga hindi ako comfortable going to hospital, nag-pass due ako ngayon. So, pwede ko ba siyang kasi I was planning to defer it until hanggang last quarter na lang sana of the year kung medyo stable na yung situation. Kaya lang, kung makukulangan ako kasi supposedly twice a year ako this year.
You know, what I do, yung patients ko, pag 5 years na siyang disease-free, I advise them to go back to their general practitioner. Kasi wala na, thing of the past na yung cancer. It's done. It's your past history. It's not your current history.
So, pwede na rin ako hindi mag-solidronic, Doc? Medyo mahal din kasi yun.
Pang-osteoporosis yun? Are you still on tamoxifen?
Oh, yes. I'm on Femara right now. I was asking my onco nga sana kung pwede ko na ring itigil yung Femara ko on my 8th year na ako. Kasi medyo mahal siya ngayon. Hindi na ako makakuha ng support sa PCSO right now. Medyo mahirap. Parang hindi ko na siya masustain eh. Kasi mahal sa Mercury ako kumukuha eh.
I will not tell you what to do or regarding your current medication. It's not my place. And it's up to you kasi mas kilala ka ng doktor mo. Pero what I want to reassure you is even if your zoledronic is not done this month or next month pa nga eh, hindi naman siya kailangan na talagang every 6 months. And perhaps call your doctor, palagay ko, yun din ang sasabihin niya. Tawagan mo. Oo.
Thank you.
You're welcome.
Okay. Thank you, Doc.
All right. So, yeah, I think po marami pong questions but all were actually answered already at one point in our webinar today. So just for everyone who's in our webinar, pwede po nating panoorin ulit itong webinar na to. It's on replay via Facebook. So yun po. What else? Cara, Crisan, anything? Yeah. No more na?
Doc, what sort of PPEs do you have to wear? Do you have to do mask, the face shield? Do we have to do the coveralls?
Pagka nasa hospital? For chemo,
Yes.
you mean?
Yes.
Okay.
Or for tests?
Or if you, okay. Face masks. Yung iba, optional. If I were a breast cancer patient and I needed to go to the hospital, I would be wearing a face mask. I would put on a face shield, and that's it.
Thank you, Doc.
So face shield and okay na siya. Okay. Yeah, ano pa po ba? How about you, Cara? Anything?
I just want to confirm that for long-time survivors, when does their immune system bounce back?
Unfortunately,
Go lang, Cara. What's that?
when does the immune system of cancer survivors bounce back to normal or to pre-cancer status? The immune system kasi ages. So time weakens it. Unless, but it will, even if you're someone who exercises every day, eats a healthy diet, like that. So I don't think we should expect your immune system to go back to the way it was when you were 5 years younger or 10 years younger. But as to be at par with your age group, for example, with all the others of your same age na hindi naman nagkaroon ng cancer, hindi kasi natin mini-measure yan, no, on a regular basis. So wala akong alam na epidemiologic studies that have looked at the immune system. The studies that were mentioned by Dr. Servan Schreiber are those that allow oneself to maximize the health of an individual's immune system, which really is the only one that matters, right? Not in comparison to anyone of your same age, but how can you maximize the health of your own immune system at any stage of your cancer? And so these are the things that I would advise. But when it will go back to being as if you never had cancer, I would, if I were to guess, I would say when you're done with maybe 5, even up to 10 years, past 5 years, normal ka na ulit eh. Once you're cured, normal ka na eh. In fact nga, baka nga mas malakas pa eh. Kasi sa lahat ng nadaanan mo, it might even be stronger.
Thank you.
All right. Ito po, Doktora, medyo particular po siya sa case niya. It says, I'm a stage 3A breast cancer patient, had my chemo and radiation, recently had my PET scan. PET results show likely meningioma. I'm not too sure kung tama po, meningioma, which is not FDG avid. There is no evident midline shift. Is it dangerous? Pasensya na po, napaka-technical po.
For some reason, parang I have seen meningiomas in my breast cancer patients. So, pero ibang sakit yon. It's a bukol na benign sa breast. Sa brain. Sa brain. Kailangan din ho yan pakita sa neurosurgeon or neurologist or to your medical oncologist na magpo-form ng team to assess what is the best thing to do. Kasi yung iba po, ino-observe lang. Yung iba, tinatanggal yung meningioma. Is it dangerous? It depends on where it is in the brain. It depends on whether it's growing or not. It depends how it affects your mental and physical health. Kung tahimik lang siya and would not have been discovered kung hindi kayo nagpa-PET CT, again, depende yan sa usapan ninyo ng doktor. Yung iba, nahayaan lang. Pero hindi lahat ganun ang sagot o ganun ang gagawin. Patingin niyo po sa doktor niyo.
So, to our sister na nagtanong po, again, go back to your doctor po. Mas safe ang answer. Okay, ito po, curious lang din po ako because I'm a triple negative. Any new findings or targeted drug po for triple negatives after chemo and radiation? Baka lang po meron tayong bago.
Naghahanap pa po. Kasi po yung mga known targets, wala po kayo. So, meron po pinag-aaralan yung i-target yung sa immune system, yung PD-L1. Pero wala pa pong result. Pero pinag-aaralan.
Okay. So, pinag-aaralan. So, wait lang tayo, mga ka-triple negative. Ayan. Anyone else? Meron pa po ba tayo? Yeah. Yeah. Okay. Ito, Doktora, I had my chemo last September. My menstruation stopped and I'm currently taking Tamox. When will my menstruation come back? Or will it come back pa po?
How old are you?
Okay. Kung nasa mga, ayan po, mga ano daw po, 47.
And how old was your mother nung nag-menopause siya?
Malapit po ba yun, Doc, if ever?
And tamoxifen.
Correlation.
Oo. Tamoxifen can lead to an earlier menopause, which is good. You want your menses to stop when you're on tamoxifen for ER-positive breast cancer.
We have to thank Doctora already. That's all the time we have for this webinar. Marami nang nakapag-free consultation kay Doctora. Nicoy?
Yeah. All right. So again, pwede po ninyong balikan yung naging presentation ni Doctora via our FB Live. It will be replayed there. And then, yeah, just a few announcements for I Can Serve. We are still raising funds for PPEs, masks, and face shields. If you'd like to help, you can message us privately. And then for our Magsikilos project wherein we transport patients, we are also still looking for volunteer drivers and volunteer vehicles as well, so that you can help as we transport patients that are currently undergoing treatment, because as you know, there is no public transport yet, and kung meron man, ang hirap makuha or crowded pa rin. So we're doing our best to be able to help and service our our sisters who are undergoing treatment. Yun. And then last but not the least, we'd like to make a shout out to all cancer support groups who are present today, who have made themselves available for this webinar. I Can Serve Cebu, our sisters from PGH, as well as Marikina. We also have sisters from Taguig, and the BFF, or Best Friends Forum from the NKPI. So, yun po. So, as a tally po, go ahead, Carla.
Jerry, baka raw makalimutan ni Doc yung contact info. Doc, pakipadala na now sa chat group natin para maipasa ko po sa kanya. He's waiting for a private chat dito po sa Zoom.
And then our rough tally for today, we had around 80 on Facebook Live and around 35 on Zoom. So we're around mga 120 po. So I think that was we had a very good number today. Yun. So yeah, I think that's about it. Cara, Crisan, any last words from you guys as before we close? Thank you, Dr. Trixie. Thank you so much. Ang dami po namin.
Thank you.
Thank you, Doctor, and thanks to everyone.
Thank you. Stay safe.
All right. Thank you, everyone. And yeah, we hope to see you in our future forums for I Can Serve. God bless everybody. Please stay safe. Thank you.
Thank you.
Thank you. God bless.
Bye.
Good weekend.